Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about postpartum depression. In this video, we'll first look at what postpartum depression is. We'll then look at some risk factors, symptoms, effects, treatment, and we'll finish off by looking at some coping strategies. Having a baby is an exciting experience, but it can also be overwhelming. It can create emotional, physical, financial, and social changes, which can lead to symptoms of postpartum depression. Feeling down after childbirth is completely normal for mothers. However, if symptoms last for more than 2 weeks, this may be a sign of postpartum depression. Postpartum depression, or perinatal depression, is a type of depression that occurs within the first few weeks, months, or up to a year after having a baby. It affects 15% of people after delivery. It not only affects a person giving birth, it can also affect surrogates and adopted parents as well. There are 3 types of postpartum mood disorders. The first type is postpartum depression, which we will discuss later in this video. The second type is postpartum blues, and the third type is postpartum psychosis. Postpartum blues, or baby blues, affects 50% to 75% of people after childbirth. People with postpartum blues experience frequent, extended, and spontaneous crying sessions, as well as anxiety, unhappiness, and exhaustion. Symptoms usually start within 1 to 4 days after childbirth and typically ease up within days to 2 weeks with no treatment. Postpartum psychosis is rare, as it affects 1 in 1,000 people after childbirth. The symptoms begin soon after delivery and can last from weeks to months. The symptoms can include having delusions, mania, paranoia, confusion, severe agitation, insomnia, hyperactivity, rapid speech, and feelings of hopelessness and shame. Postpartum psychosis is severe and requires emergency medical attention due to a higher risk of suicide or harm to oneself or their baby. A person can be treated with hospitalization, therapy, and medication. Risk factors. There are several risk factors that increase the chances of postpartum depression. These include a personal history of depression or anxiety, a family history of depression or other mental health conditions, a change in hormone levels, stress due to caring for a newborn or other stressful life events, sleep deprivation, being a first-time mother, being younger than 20, being a single mother, isolation, a lack of support from family or friends, relationship issues with one's partner, experiencing abuse or violence, financial issues, social inequalities such as poor housing, having a baby who cries more than usual and is difficult to comfort, having a baby with special needs, and medical complications such as premature birth. Symptoms. People with postpartum depression may feel ashamed for experiencing their symptoms. It is important to know that many other parents can experience these symptoms too. People who have postpartum depression can experience the following symptoms: depressed mood, anxiety, loss of interest in things that one would typically enjoy, including the baby, changes in weight or appetite, difficulty sleeping, fatigue, decreased concentration, lack of motivation, restlessness, feelings of guilt, worthlessness, and hopelessness, sadness, spontaneous or excessive crying, social withdrawal, headaches, digestive problems, and suicidal ideation. Effects. If left untreated, postpartum depression can cause a lack of energy, moodiness, inability to focus or make decisions, thoughts about hurting oneself or their baby, trouble bonding and connecting with the baby, and skipping pediatrician appointments. Postpartum depression can also affect the baby. The baby may have behavioral or learning problems, develop feeding and sleeping problems, have an increased risk for obesity, have an increased risk for developmental disorders, develop impaired social skills, and may be neglected, or an illness may not be recognized by the parent. Treatment. Treatment for postpartum depression can vary on the severity of one's symptoms. The types of treatment can include psychotherapy, including cognitive behavioral therapy or interpersonal therapy. Cognitive behavioral therapy educates people on different ways to think, behave, and act in situations. It challenges people to transform hindering thought and behavioral patterns to improve their emotions. CBT sessions can be individual or in a group. Interpersonal therapy aims to improve people's communication skills in their relationships, develop support networks, as well as developing realistic expectations for certain issues that contribute to their mood. Other types of treatment include medication. A healthcare provider might prescribe antidepressants, which balances brain chemicals that affect mood. Hormone therapy, massage therapy, light therapy, and lastly, electroconvulsive therapy, which is used for people who have postpartum psychosis and who may not respond to treatment at a treatment center. Electroconvulsive therapy is a procedure in which a mild electrical current is used to cause a brief seizure. This is effective in treating serious mental health conditions. Coping strategies. It is important to take a step back, recognize one's symptoms, and learn to take care of oneself. To cope with postpartum depression, a parent can communicate openly about one's feelings, join a support group for parents, spend time with family and friends, or find ways to communicate with them through text, call, email, or social media. Make time to spend with one's partner. Ask for assistance with errands or chores. Ask for help to take care of the baby. Set realistic expectations. Avoid worrying about insignificant tasks and lessen unimportant responsibilities. Engage in self-care and doing enjoyable activities, such as reading a book. Eat healthy and exercise when possible. And making time to rest. Partners, family members, and friends can also play a role in one's recovery by providing support. They can encourage the parent to open up and communicate about their feelings. Inform them that it is not their fault. Remind them that you care and are there to support. Help with childcare, chores, and errands. It is okay to feel tired and overwhelmed as a new parent. Taking care of a baby requires a lot of time and energy. With professional help, people can overcome their symptoms. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.